director and one of the physios at Alchemy. So today I just wanted to talk you through a couple of things that we can be doing via telehealth for the postnatal population. So look, my absolute passion is obstetrics, so pre and postnatal care. So I love seeing all the mums and babies. But I also really enjoy treating both women and men in terms of pelvic floor dysfunction as well. So that's where my experience and my passion lies. So in terms of the postnatal population, look, a lot of people think, well, look, physio is a hands-on treatment. I really don't know whether I'll be able to get any value or get anything from a telehealth consultation, which would be fair to assume that. However, there is an awful lot of things that we can actually be doing for you, and there's a lot of things that we can actually get a really good gauge on over a video consultation. So look, the first thing in the postnatal population that I'd say that we can help you out with is breastfeeding dysfunction. So any mastitis or engorgement, blocked ducts, even thrush, breast thrush. So all of those sorts of concerns will absolutely be able to give you a helping hand to manage your symptoms. So there are all sorts of things like self-treatment techniques like massage or using a vibrating toothbrush to actually try and help that blocked duct or help that milk that's sitting there actually get moving again. There's obviously many bits of advice that we can be giving you in terms of how to attach your baby effectively and what to look out for when you are attaching your baby. There are plenty of stretches and positions that we can be giving you to improve your comfort and hopefully successful breastfeeding in that postnatal phase. Now look, I can also be giving you advice in terms of compression and lots of other supportive techniques that can really assist you to breastfeed. So that would be the first thing that I'd say we can absolutely help you out with. The second thing would be pelvic floor care. So look, there's an awful lot of concerns women experience after having their baby in terms of pelvic floor, either trauma or actually trying to or wanting to rehabilitate their pelvic floor as best as possible. So when I'm talking about trauma, I'm talking about if you've had any sort of stitches or episiotomy or significant stretching actually occurring during the labour, but then naturally also during that pregnancy we will have an element of stretching and weight that's placed on our pelvic floor. So there's an awful lot of advice that we can be giving you in terms of precautions, because there's specific things that we really want you to be avoiding in that postnatal phase. And also importantly, there are many things that we really want you to get started with from a pelvic floor perspective. So we'll absolutely be able to guide you through that. In terms of pelvic pain, we can be giving you lots of advice in terms of returning back to intercourse and actually how to manage and navigate that with a little less fear and concern, and so it's all a little bit more comfortable for you. We can give you basic scar management advice and to actually get started with some gentle desensitization of that area as well, especially if you've had stitches. We can be giving you significant advice in terms of precautions, as I said earlier, and what to avoid. And we can be starting you out with some really basic pelvic floor exercises. Even if we haven't done a thorough internal examination, we can be giving you some very basic exercises, which are primarily based around effective breathing techniques. Because if you aren't breathing effectively, that can actually significantly impact how effectively your pelvic floor is going to be functioning. So that's a really important thing to get checked. The next thing that I'd say we can absolutely help you with is any sort of bladder or bowel concerns that you're experiencing. So any incontinence or lack of control or lack of confidence around your bladder and bowel control. But also if you're finding that you're going to the toilet all the time and you're not quite sure what to eat and drink, we can be guiding you through all of that. We can be guiding you through positioning and how to actually empty your bowel or your bladder a little bit more comfortably and more effectively. So there are plenty of things we can be doing from a bladder and bowel retraining perspective. The next thing that we see an awful lot is abdominal separation. So we can be doing a really basic abdominal wall assessment via a video where we'll ask you to get into certain positions and ask you to do certain things with your tummy. We'll actually look at what your tummy actually does, and from there we can be giving you some very basic exercises. But again, and probably most importantly in that early phase, it's what to avoid and what to try and do to improve the natural healing and recovery of the abdominal wall. In terms of any separation, we can be giving you significant advice with abdominal support and compression, which is a really, really important part as well. So we can be having a look at what you have currently, and we can be also giving you advice in terms of what you could be purchasing online or purchasing, from somewhere else, to give you a little bit more support through the abdominal wall and help with your natural healing and recovery. Another thing that an awful lot of postnatal women experience is neck pain and back pain and joint pain. So we can be doing a basic movement assessment over the phone or over the video consult, and giving you some really, really great self-massage techniques and stretches and advice regarding certain movement positions and repetitive movements or postures that you may be getting into that can actually assist reducing that pain. Another thing is ergonomics, everyday ergonomics. So the way that we're bending, the way that we're moving. As a new mum myself, I completely appreciate now how repetitive movement is after having a baby, and you tend to get into positions for a very long time as well. So we can be having a chat through the positions that you're finding are problematic and actually brainstorming an easier way for you to make that position or that movement more comfortable for you. One thing that a lot of women really want to get back to is exercise, to feel like a little bit of themselves is returning, but it's also really, really important for your mental health and your general everyday well-being to start to return back to some exercise. And I think a lot of women are terrified to return back to any form of exercise because they're worried they're going to do damage. So this is really individualized. However, it's really important that you get professional advice with what you're actually doing, because again, you can actually do damage. So if you're doing the wrong thing. So it's really, really important that we can actually give you advice and some recommendations in terms of what exercise would be appropriate. And that's really guided around your goals and really what you're wanting out of the exercise. So look, they would be the primary things that I'd probably be suggesting that we can be giving you help and advice with in that postnatal phase, but really there's just so many things that we can help you with throughout that time. You'll be amazed at what we can actually do via telehealth, what we can actually see and what we can be giving you via telehealth. So I would really encourage that you give it a go, even if you've never done a telehealth consult before. Give it a go, see what you think, and I promise you won't be disappointed with how much value you actually get out of the consult. So to book a telehealth consult with us, all you can do is either call, so our number is 54749093, or alternatively, go onto our website, go find the Book Now button and just click there, and then you can click physiotherapy, and then you can select telehealth initial if you're a new patient. However, if you've seen us before in clinic, just click telehealth follow-up, and you then just select the clinician that you would like to see. So that is a basic sort of list of things that we can be doing in the postnatal phase or via telehealth. Please give us a call. We would love to see you and help you in this postnatal phase. Have a great day. Bye.